Hello everybody, welcome to today's episode and we are here to welcome Dr. Sandeep Harkar. Welcome sir. Sir is consultant in Urology department with a great amount of experience ranging between 20 plus, and today we are going to talk about frequent urination. Sir also comes with an experience of acquired international fellowship and attended Europe program in Prague. He's a certified robotic console surgeon, which speaks volumes about his experience and expertise. So sir, we will start a small rapid fire which we feel that there are very common questions that people tend to ask, and we would love to have your expert opinion onto that.
Sure.
Moving to the first question, what defines urinary frequency and how much is considered too much?
See, urinary frequency is a broad term, and it is defined as passing urine more frequently than normal. So it depends on the fluid intake also. But as a guideline, if you are passing urine more than 6 to 8 times in 24 hours or more than once in night time, you have to get up. That is more than normal.
Okay, and what could be the possible causes in men and women?
See, their causes are many. The most common, physiological can be if somebody is drinking too much of water, or somebody during pregnancy also, there can be more frequency. But then pathological reasons which are problematic include most commonly urinary tract infections or overactive bladder. It's a condition which is found in which the bladder starts sending signals too frequently to the brain that it has to empty, even if it's not full. So that's the overactive bladder, very common condition. Otherwise, the medical conditions include diabetes or some neurological problems. Sometimes anxiety itself can precipitate increased frequency. So there are many conditions, and in males especially, prostate related problems can also lead to increased frequency.
Okay, and how can these urinary incontinence problem can be differentiated to the other urological problems that we have?
So I think this very simple to diagnose, because we need a simple urine test, urine routine microscopy, which rules out a lot of things, and second is an ultrasound, in which we want to ensure that the bladder is emptying completely or not. Sometimes the bladder is not emptying completely and patient feels the urge to pass again and again and again. The treatment completely changes. So an ultrasound, urine routine test are the basic things which help us differentiate between the conditions and accordingly treatment.
And if we talk about the treatment options varying from lifestyle changes to medications to other advanced treatment, what are the treatment options available?
So I really feel that patients need to visit the doctor, because this is a condition which really cripples a person. He can't attend the meetings, he can't travel, he can't go out, he feels really embarrassed, and it's really very easy to treat this condition. So I urge the general audience to visit the specialist for treatment. So treatment I usually divide into various phases. First is lifestyle modifications, which include fluid management, like you need to space out the fluid intake throughout the day, not excessive fluid intake in one go. Second thing is decrease your intake, liquid intake, fluid intake in the late evenings, in the last 2 hours before sleep. In addition, dietary changes like decrease the intake of caffeinated drinks, carbonated drinks, and alcohol, even smoking. These things need to be curtailed. Then comes the behavioral therapy, like training your bladder to hold for a little bit more time, maintaining a bladder diary, and timed voiding. Don't wait for the complete urge to happen. Just time your urinations. And there is something called as Kegel's exercises, in which the pelvic floor muscles are strengthened, which help us to hold for a better time, so the urgency and frequency is decreased. So then comes the treatment like medications. There are very good safe medicines which can be tried and helps a lot in dealing with the frequency. And if these things fail, then there are some medicines which can be injected into the bladder, like Botox, to relieve the bladder to decrease the frequency. In some males, we need to, in addition to medicines, we may have to undergo some procedures like prostate surgery or other nerve related treatments.
Thank you, sir. I think we You beautifully gave us a snapshot of what exactly it is about urinary incontinence, which is a crippling issue these era and nobody talks about it. Thank you so much.
Thank you so much.